I'm Gary Manns. I'm the Associate Vice President for Marketing for the USA Health, and it's my pleasure to welcome each of you here this morning. It's nice that we actually were able to have such a beautiful morning here in October. It always could have been a lot warmer. Sorry that you're having to look into the sun a little bit, but unfortunately, it's how the site set up for us. It's my pleasure at this time to welcome our Chief Executive Officer for USA Health, Mr. Owen Bailey.
Well, good morning. And there's plenty of seats down here if y'all want to come grab a seat. Not that I'm going to talk long, but I got a laugh. Yes, thank you all. Fill in these seats, really. That would be nice. I do want to welcome you and thank you for being out here on this exciting, groundbreaking ceremony day. And I do thank you for practicing good social distancing and masking. But thank you for being here today. You know, in healthcare, we talk a lot in what we call TLAs, three-letter acronyms. And we're going to introduce another one today called an FED. So that is a freestanding emergency department, so that's why we're here. But in healthcare, we use MRI and ICU and CON and AED, and so now you've got FED to add to your vocabulary. This is a very exciting and very impactful project, and projects like this take a lot of planning and a lot of expertise, and we're blessed at USA Health and at USA to have some incredible talent. And I want to spend a few minutes just starting to thank those who've played key roles in getting this project going. Starting with Jimmy Schumacher. Jimmy, our chairman of our board, who's one of the most committed and hardworking people I know. And thank you, Jimmy, for your leadership and your board's support. It means the world to us. Dr. Tony Waldrop, USA president. We can't thank you enough, Dr. Waldrop, for your vision, for your support, and for your constant encouragement. It's very much appreciated. Dr. John Marymont in the back there, who is the dean of the USA College of Medicine and Vice President of Medical Affairs for USA. He oversees the entire health enterprise, and we appreciate your leadership and your hard work as well. He's also a very well-respected orthopedic surgeon, so he knows a little bit about ERs himself. Dr. Alan Whaley, Alan, right there, is Chief Operating Officer and Associate VP of Medical Affairs for USA. Quite frankly, much of our growth these last few years in expansion has been a result of Alan's leadership and hard work. I think he knows every physician in Southwest Alabama. We appreciate, Alan, what you do. Dr. Ed Panachek, who you're going to hear from shortly, is professor and chair of emergency medicine at USA. He has a national reputation, a good one, in emergency medicine, and we're fortunate to have him here, and you'll hear from him shortly. Sam Dean. Sam is the administrator at University Hospital and also Assistant VP of Medical Affairs. A lot of the tremendous growth we've had at University Hospital has happened under Sam's leadership and that of his team who work with him. Sam, we appreciate that. And I know Alice Johnson, Assistant Administrator, has been working very much on this project as well. So thank you, Alice. And I see Lisa Mestis back there, CNO as well. I know she and her team have been involved in this too. Randy Moon, Randy here. I want to give Randy a shout out. Randy is the USA Associate VP of Facilities Management. We're very fortunate to have Randy and his vast expertise in this project and that of his team. He's fresh off his latest project, a little project called Hancock Whitney Stadium, which has been exceptionally well done. And congrats to Dr. Erdman and that whole team. But thank you, Randy. And also Jim Walker. Jim in the back, architect with GMC. Thank you, Jim, for your expertise, and you are a pleasure to work with. We appreciate your work as well. There's many more people involved. I wanted to highlight those for us. You know, we're the only academic health system in this region of the Gulf Coast, and which means that we only don't just provide the clinical care, we also are committed to education and to research. Our mission statement is we help people lead longer, better lives, and we think this facility will help do that as well. As most of you know, we're a safety net organization for the region, and much of what we do is done by no one else. So it's really exciting lately. We continue to attract some of the brightest minds from around the country and around the world to join our team. In the last 4 or 5 years, we have just had tremendous growth, really unprecedented growth. We've added people, including providers, added new services, added new facilities, and this kind of rapid growth can also be stressful on a team. And I want to take a quick moment just to thank the entire USA Health team, so almost 4,000 of them now. They're so talented, so devoted, so hardworking, so caring. Many of them are here today. And this has been, quite frankly, a very challenging year. With all the growth that I'm talking about and a COVID-19 challenge on top of that. And our team has handled it extremely well with that same commitment to excellence that they always have. And this facility that we're celebrating today is going to be another example of that commitment to excellence. It continues a trend we have been on to take services out of our main facilities, out closer to where the patients are, to provide convenience and also to spread the academic mission. And I think it's important for a couple of moments to place this facility in the context of our overall footprint and how it has been changing. So just bear with me a minute or two while I talk about our recent growth in the last few years. Looking here in West Mobile first. It was a big moment when Mobile Diagnostic Center and their 25 plus physicians joined us a few years ago, and we've been doing renovations for them down the street at the USA Commons. We've also added a clinic down the street on Hillcrest with Doctors Evans and Weatherby. We have a clinic out on Schillinger and Cottage Hill, physician office with 2 new physicians about to join there. We have a new clinic which opened up recently in Sims with Dr. Jimenez. And we have just recently announced a new physician office partner right down the street here of Family Practice Associates on Hillcrest, which is Doctors Hall, Delaney, Briers, and Matheson. Moving east just a little bit, you'll find Dr. Bodie and Dr. Swain in their new dermatology office on Old Shell in Spring Hill. And then you'll see the Dolphin 65 multi-story building right at the interstate. We now occupy 2.5 floors of that. Proud to have our name up on that building. And that houses urology and soon to house cardiology and neurosurgery. Moving to Midtown, you've got the Strata Patient Care Center, which has made a huge difference for us. You've got a new Midtown clinic, wrapping up construction hopefully by December on Old Shell Road. You've got the Fannie Meisler Trauma Center about to open this fall at University Hospital. That project's obviously tied to this one. And very soon you're going to be hearing more about a pediatric emergency department at Children's and Women's, and I see Chris Jett here, and we appreciate his work on that, and that's going to be exciting. Moving on downtown, you've got our testing center, which is now in the Civic Center, a partnership with the City of Mobile. I see Michelle Dudley here and her team, and Natalie Fox have worked tirelessly on that, and that's made a very big difference in our community in dealing with the COVID challenge. And now if you move across the bay, continuing east, we have a clinic in Fairhope, which is primarily pediatric specialties. We have a new clinic in Daphne, which is focused on endocrinology and diabetes. And we have the Mitchell Cancer Center, of course, in Fairhope, which is the Kilbourne Clinic, which has had a huge impact. They're very busy and they're about out of room. And our most recent announcement is the MAP Family Campus at Highways 104 and 181 east of Fairhope. And that's going to have a very important academic focus in Baldwin County and bringing our expertise, our specialists closer to those patients, as well as a focus on wellness, prevention, and nutrition. And we're in a CON process right now to try to get approval for an ambulatory surgery center or an ASC. There's another TLA. So thank you for listening to that. If you listen to a few years worth of work and realize how much our footprint has expanded, you start to get an appreciation for how this project fits into that continuum of care. A little bit about this project. It is a fully functioning emergency department. I see a number of our emergency folks here today. Thank you all for your tireless efforts in what you do and taking care of thousands of people every day. We're going to be open, obviously, 24 hours a day, 7 days a week. It's approximately 22,000 square feet, 14 treatment rooms, 1 trauma room, and 2 triage rooms. We expect to see about 15,000 patients a year, with another 5,000 or so for the imaging functions. We'll have board-certified emergency physicians, a full range of diagnostics and imaging, CT, MRI, X-ray, ultrasound, mammography, probably close to 35 or 40 new jobs for the area, and it'll be a great training facility for our educational focus for all types of students, including providers. You know, I think it's an important point is that so many of the local ERs, including us, have to go on diversion from time to time because the volumes are so high. This additional capacity is going to help that situation in the market because, especially being the only Division One, Joel, the only level one trauma center in our market, it's very important that we stay off diversion as much as possible, and this will help in that regard. So we think that's going to play a key role there. We're excited about the proximity to the USA campus with this facility. Our relationship with campus is strong, and I think it's going to be even stronger with this. The impact on students, on faculty, and staff, I think is important. We also like the proximity to USA Jaguar Athletics. We work closely with Dr. Erdman and his staff. We've talked with him lately a lot about a vision for where sports medicine is going. This facility can play a key role in that. And finally, I think it's important that this project is the beginning of what can be a broader campus on this property that could include other patient care services and a wide range of physician specialties. So finally, I'll close by saying, I've talked a lot about buildings today, but I always like to remind us it's not about the buildings as important as they are. It's about the people in the building, the people doing the serving, and the people receiving that service. And I know our staff is focused on that. So thank you for listening to these introductory comments, and thank you for being here today. Real excited about this project. It's going to take about a year to build, so hopefully I'll see you all back here in about a year, and we'll celebrate the grand opening. I'm going to turn it over now to Dr. Ed Panachek. As I said earlier, we're very, very fortunate to have Dr. Panachek leading our emergency medicine function at USA Health. Ed?
Thanks, Owen. As an emergency physician, I obviously strongly endorse social distancing and wearing a mask, etc. I just took my mask down because I was asked to do so that my voice would pick up better for the filming, etc. here, but I will put it right back on immediately afterwards. As a 1981 graduate myself of the University of South Alabama College of Medicine, I have long-standing ties and also deep affection for both the university and for the Mobile area. When I returned in 2015 to my current position, it was with the goal of partnering with the university and USA Health to literally transform emergency medical care for this area. As we stand or sit here today, I think we can honestly say we truly are doing that. Let me give you some examples. The state of Alabama has long had a tremendous shortage of qualified, specialized emergency physicians. Indeed, Alabama is second last in the country with the lowest number of board-certified emergency physicians per capita of any state. Second last in the entire country out of all of the states. That obviously needed to be addressed. About a year and a half ago, we started a new emergency medicine residency training program to start addressing that problem. This last July, we just enrolled our second class of new emergency medicine interns. So that program is up and running and off to actually a very strong start, and we're very proud of that. Second, we for years have hoped for and dreamed for a new, larger, state-of-the-art emergency department that would be consistent with a true academic university medical center that is also the region's only one-level trauma center. As I think everyone in this crowd knows, and anyone who has driven past University Hospital recently, we are on the cusp of taking possession of that due to tremendous, wonderful donations and support from the state. The Fannie Meisler Trauma Center is about to open within months. That will essentially about double our ability to provide acute care to our patients at that hospital, both trauma and other illness patients also. So we're very excited about that. We're now here talking about a new freestanding emergency department in this area. And this is another example of transforming emergency care in this region. I think all of us have seen medical TV shows over the years, and they often are littered with great drama in the emergency department, etc. Although those shows are essentially fictional, they do contain some truths that the public has recognized and come to expect with emergency care in their own lives. And those truths apply directly to this freestanding ED. So one of them is that time matters, that literally minutes can make a difference. We know this for certain in acute stroke care, but we also know it for sudden heart attacks, acute severe trauma, the golden hour, et cetera, et cetera. This area where the freestanding ED is going to be located is an area that has undergone tremendous population growth in West Mobile over the last 10 to 20 years, but the healthcare facilities have not kept pace in terms of growth of those facilities also. So this is very well located to provide that acute emergency care to people who live and work in this area and shave literally many minutes and perhaps life-saving minutes off the care they need if they have a sudden acute medical condition. Second, it's now recognized by the public that it isn't just an ER with brick and mortar. When they go in to be seen in an emergency department, they don't want to be seen by just anyone. They want to be seen by a qualified, certified emergency medicine physician specialist. That is now the expectation in the national standard. And that, as Owen mentioned, is exactly what we're going to be doing with this new freestanding emergency department. We are going to be staffing it with highly qualified emergency physicians. Third, it's recognized that academic medicine and academic medical centers make a difference. They provide state-of-the-art, cutting-edge technology and care. They're constantly seeking, researching new ways to provide better care to patients for better outcomes. And having a freestanding ED out here isn't just any freestanding ED. This is a freestanding ED that is associated with an academic medical center, and so it will be bringing pieces of all those advantages that an academic center has out to this freestanding ED location. And just as importantly, it will provide relatively seamless, easy, quick transfer of patients who need inpatient care, acute stroke interventions, et cetera, straight into all of the academic services that are unique that we have at University Hospital for trauma and acute stroke, and straight into acute pediatric subspecialty care capabilities that we have at Children's and Women's Hospital. So those are all tremendous advantages. We're very excited about developing this new freestanding ED. We know that it will be a gorgeous facility. We expect it will be equipped with the latest in equipment. We also believe, though, that this is important because this is a win-win all around. It's a win for those individuals who live and work in this area to have a freestanding ED of this quality right here in their backyard. It's also a win for our academic programs. This is going to provide new training opportunities for residents, for medical students, nursing students, and other in the health professions studying at the university campus. So convenient, essentially right across the street here from the campus for that. So with that, thank you very much. We're very excited about this. Enjoy your day.
And with that, let's turn some dirt and get this groundbreaking formally finished off. On three.
Is it the tallest?
Where are we looking?
I'll call it out.
Hi, Gary, let me get a couple pictures before they actually start turning dirt. Everybody look right here. Okay.
1, 2, 3. Thank you, folks.
That's pretty clayish soil.
That was tough right there. That's Alabama dirt right there.
Yeah.
I didn't throw much.
That wasn't sandy loamy.
Thank you, everyone.